Good evening, everyone. Welcome. We are going to start our class off in sitting today. Putting yourself in a comfortable position to start our practice today. I'm starting in sitting. However you start, allow for your body, the bones of your body to touch the earth, whether it's the feet, the pelvis, the long bones of the legs, or your back if you're lying down. And as I mentioned in my email that I sent out earlier before class, we're going to focus on the vagus nerve today, as well as mobilizing the long nerves of the body. And they're connected and interrelated. I won't really talk about that as much as we'll experience. This is an experiential class. We're going to start first with reminding ourselves of the intention that brought us here, whether it's to reduce suffering within ourselves or to bring ease in some way within our environment. It's taking a moment to settle in to a positive intent that you might have for yourself. We allow for a little bit more space for ourselves. We are able to bring spaciousness to what's around us. One way to cultivate that space is to deepen the breath, to allow for your breathing to expand and take shape. So if you can deepen the breath in some way, allowing the breath to come into the body, allowing the rib cage and the belly to expand, front, back, and sides. Allowing the eyes to rest on the horizon or closed. It's helpful to have the eyes slightly open, letting the gaze get soft. And if you're sitting or standing, allowing the eyes to be cast down so that they're looking down towards the lower third of your visual field. This helps the nervous system to start to settle. You can do this in lying down as well. At any point in our practice today, you're welcome to stop and pause and bring yourself back to the breath and the gaze, softening the gaze, allowing the eyes to lower and the breath to deepen. It's great practice to do during your day. Even just setting a timer for a minute, allowing your eyes and your breath to soften and deepen. For those of you who'd like to continue in that space, you're more than welcome to do so. We're going to continue with the soft gaze and the breath, but bringing the hands up to the space underneath the collarbones. We're going to do some tapping here, very light tap, so that the fingers are tapping on underneath the collarbone, one side and the other, and we'll do it about 60 times on each side. And with soft fingers, we're going to place our hands at the base of our skull, where you'll feel a knobby bone here, right above the top of the vertebra. And very, very gently, pressure of a nickel. We're going to place our soft fingertips on this bone and in the space between the skull and the first vertebra. We're just going to do some very, very soft circles here. Both sides. We'll do that about 10 times. And then sliding the fingers down a little bit so that we're moving along the base of the skull. Doing another 10 movements. What this does is it moves any fluid, or sometimes the muscles get inflamed here during the day. This just helps move any fluid and helps relieve any pressure off the vagus nerve. And then with the flat of your fingers, very gently start to bring the fingers forward along the neck. Down, so we're bringing forward and down. As if we're trying to bring fluid down from the neck, down to the collarbone. And then with our fingers sliding the skin along the collarbone. We're not sliding the fingers over the skin, we're bringing the skin with us over the collarbone. So this is 5 times. And then under the collarbone, sliding the fingers along the skin towards the armpits. And then last one, fingers soft. We'll put the fingers in the armpits and we're going to move the fingers deep into the armpit, pressing up and towards the heart. So both sides, you can do one at a time. You can do this, I would say 10 times. And this area, these deep lymph nodes are what help drain the head, the neck, and actually the rest of the body. It's why for women it's incredibly important. Otherwise, the toxins tend to back up into the lymph nodes of the breast. It's really letting yourself sink into this. And then release that, bringing the hands back. And pausing for a moment, taking some breaths in and out. We're going to go into these 6 movements of the spine. And so it's very important to mobilize the trunk before we start to work with the rest of the body, because the spinal cord is here, and when we can move the spine a little bit, that brings fluid, nutrition to that area, releases any restrictions, which allows us to move in a way that we need to move. We've done the vagal nerve and the lymphatic movements already. So we'll start first with the 6 movements in the spine. You can do this sitting or standing. And standing, we're just going to sit back with our weight into our heels a little bit here. If you're sitting back into the pelvis. And then we'll start with drawing the belly button into the spine, tucking the tailbone under. So this movement is primarily in the lower body. And then inhale, release the belly, reversing the curve. Exhale, drawing the belly button in. So we do this 5 to 10 times, finding a quality of ease of your movement and breath. It's helpful if you can breathe in through the nose And in these movements, it's nice to breathe in and out through the nose. But when you're first starting, it can be helpful to breathe out through the mouth, just helping the body start to accommodate this kind of breathing. And we'll start to expand the movement now by lifting the chest as we inhale, as we exhale, drawing the belly button in, move round the chest forward. Inhale, release, expand in the other direction. You notice that I'm looking up and looking down. So now my shoulders, my chest, my head are involved. And pausing, coming to a neutral position, letting the arms hang by the side, just like the shake off the day. We'll start to come into standing, letting the arms eventually come to rest. And going into the third and fourth movement of the spine, side bending, letting your body just sway from side to side. Shifting weight on your feet. Then coming to a pause, feet about shoulder width apart. We'll start to let the hip jut to one side. Letting the hands move along the sides of the leg if you're standing. If you're sitting, just let the arms be free. You're welcome to also do this lying down, whatever position is likely for you. Sliding all the way up to the armpit down. What this does is this also wakes up the long thoracic nerve, this nerve along the side of the body. Wants to wake up the inspiration and expiration muscles of the rib cage. And as we side bend, start to turn to look down through the head. So we'll start to warm up some of the muscles of the neck. Circles here with the hips. Letting the arms free. Switching directions. Pause. We're going to come back into the sitting kind of half squat position where our pressure is in, most of our weight is in the heels, 2/3 of our weight here. And we'll start to turn the body to the left, to the right. Like you can let the arms be free and start to let them swing free here. And start to come into standing as you still rotate, and then make your way down. Back up. I'll do that 3 more times. to. So very gently grasp the hands behind the back, or you can have the hands on the back of the legs, whatever is accessible to you. Bringing the arms back to the shoulders and the chest can lift a little bit here. And we'll start to do some circles here with the neck, very gently. We're not going backwards as much as we're going forward to the side, looking up and down. Switching directions. And coming back to center. So bringing the left hand to the right shoulder, we're going to very gently press down with the left hand. Lift the head and come over to the left ear, to the left shoulder. And very gently look down towards the right arm, the left arm. Very, very gentle movement here. Turning the head to look down and up. Finishing the movement, looking down and then looking to the horizon and then bringing the head forward. Releasing the left hand with this shoulder rolls here, this right shoulder. Switch directions. And bring the right hand to the left shoulder, right ear to the right shoulder. And very gently looking up and then looking down. Come up with the horizon, bring that forward. And you might notice one side is very different than the other. It might feel like a different person when you do one side. So it just gives you an idea of how incredible the body is. The body always operates to keep the eyes level as a survival reflex. And so the neck is usually the first line of defense and the shorten, contract, and lengthen accordingly to protect you. So from here, we're going to load the right arm. So bring that right arm up, raising it up to a point of comfortable, and then bringing it down. So as we bring it up next time, let the palm drop so that the palm is facing the body and the wrist is flexed. We're going to bring that right arm back and turn the head towards the left and then back. Very gently here. If you'd like, you can start to move the arm down a little bit. Pausing here, turning the arm out and bending the wrist in the other direction, bringing the arm down and up. And pausing with the arm out at shoulder level, we're gonna turn the side of the head to the left. And try raising, lowering the arm again. If you feel any numbness or tingling, then back off the bending of the head. Might even be that you don't do this at all, or tilt only slightly. Come to a pause. Bring the right hand to the shoulder and do some circles here. Which direction? And release the hand. Let's pause and just notice the shift and changes between the right versus the left side. And bringing the left arm. Bending the wrist so that the palm is facing the body. And release the arm. Pause and turn the head away. So turn the head away and head forward. And turn the wrist out now. So turning the arm out, turning the wrist. So that now we're pressing the wrist in the other direction. Raise and lower. Letting the head in the other direction. So before on the other side, just did the arm movement without the head. So make sure you're doing what feels good for you, but just have the head face forward. And on, bringing the left arm down. Bring the left hand to the shoulder, doing some circles here. Switch directions. I shift it down into the body, into the hips, and stretching more the front of the hip and the nerves of the lumbar plexus. Go back. So we're going to come to the top of our movement area so that we have enough movement or enough space behind us. If your balance is feeling off today, you're welcome to use a chair and you can step forward rather than backwards. So, in other words, some people, if your balance is off, you're feeling anxious, any one of those, you can instead step forward and the one leg will be back with the heel off the ground. Okay. Or you can be at the top of the mat with your hands on the chair and you can step back. Either way, we're going to be in this position with the left knee forward, left knee over the ankle. You can also do this in sitting. If you really feel challenged, no worries. So sit on the side of the chair so that the right leg can go back, right heel is up. And we're pressing back with that right knee. And the hands are here, below the belly. We're going to start to lift up this lower belly and start to lengthen through the top of the head as we press that right knee back. And leaving the left hand in the belly, we're going to inhale that right arm up and exhale down. Inhale up, exhale down. So continue that movement, that mobilization with the arm up. Breathe. We'll pause here, releasing the belly, letting up the left arm. Pause for and bringing the hands to the knee. And a step our feet together and pause. Over to the right leg now, breathe in and step forward or step back. Making sure that right knee is aligned over the right ankle, getting yourself nice and steady and stable. The body is our home. When we can feel stable in our home, it helps the mind to feel steady. You're really paying attention to what your body's needs are. And as we sink into this pose between the right and the left leg, just so we can ground and balance between those legs, as we press that left knee down, and we'll lift through the chest, bringing the hands to the lower belly, pressing in a little bit here as you drop the tailbone. It seems like there's very little movement. It might be that there's very little movement. Sometimes it helps to squeeze the buttock of the leg that's bent. So in this case, it would be the right knee. So squeezing that right buttock in, really engaging, as you press back to that left. Inhaling that left arm up and down. Some of you might not feel this at all, but it is happening. There is a movement of the sciatic nerve. I apologize. The femoral nerve, the front of the leg, the nerve that supplies your quadriceps, your thigh, the front of your thigh. And floating both arms up. And bring the hands to the right leg and stepping into your together. Make our way down to the floor. If the floor is a challenge, you can also do this in a bed or on a sofa. It's helpful to have a firmer surface to do this. And making sure that you are supported and won't roll off the surface. We'll start with our feet flat on the floor, the knees bent. The arms are outstretched to the sides. Assembling the bones of the body. Take some breaths here to recalibrate. Allow the heart some moments of transition. Moments of transition are the best times, the best opportunities for transformation. They may not feel like the best of times, but with every growth opportunity, it's sometimes not fun. Very gently, we're going to press our heels into the surface, lift the buttocks up and then down. So it's just very gentle squeeze of the buttocks over and down. See if you can, as you squeeze and lift, And then as you lower, see if you can just allow for a little arch in the back. Allow the pelvis to roll. Then as you lift, press back into the earth. Come gently from the bottom and bring the knees up towards the chest, giving a nice come here to the thighs, or around the thighs. Circles. So gently massaging and moving the lymphatics in this lumbosacral area here. Arms. Bring the feet up. Straight up. These are straight. Something here bending like the toes. Bring the arms straight up into the head bug. You contracting the pelvic floor, contracting the belly here. Breathe. And bring the arms out to the sides, the knees up the chest, very gently bring the knees over to the left. So here you might feel a stretch. Like to start to bring the little stretch with sciatic in the front by gliding the toe on the floor, straightening the knee. As you do so, and straighten that right knee, bring this right leg straight up. Moving the arm, squeezing, muscle, moving out, moving, build up the day. It's caught between the cells. Slows our digestion. So, to move this area, help other parts of the body. Trying to just right about pausing here. Bringing that left knee joint. And then following over to the right. Just in the body gets and bending it straight into this left knee. In that left leg. This is a challenge. We just also need the knee out. Finding the movement that best supports you where you are. That pausing, creating the right foot up, bending the knees. Toe touch down with the toes and then raise the knees up towards the knees. Back and forth a couple of times. And if there are any movements that you like to do in your movement time, go ahead and do that now. The rest of you, we're going to do a very important integrative position. It doesn't look like anything except lying on the back, but this one really helps the body and the nervous system and the muscles to integrate. We yoga called Shavasana, corpse pose. And it's really a pose of letting go. Of course, is the ultimate of letting go, obviously. So really letting your body to sink to the earth, feeling your bones. If you need to, you're welcome to have the eyes open. It's comfortable to letting go. Close the eyes, so just seeing what is best for you right now and doing that. One is the most important thing is listening to yourself. So pause here for about a minute. Body, move, bend the knees. Rolling on to one side that feels good and letting the bottom arm be a pillow. Drawing the knees up to the chest and settling into this sideline place. Sitting. Taking a moment to remember the intention of one's here. Allow yourself to really feel the movement of the fluids of your body. It's through the heartbeat, the breath. Like to continue on to meditation. This is a great time to do so. Let yourself set a timer or go to chocolate house. Dharma talk. Thank you all for being here. Namaste.